Hey, Dr. Roman, I can't see you.
Okay, let me put the camera on.
Okay, I also have to add Lee. I'm not sure how to do that. Oh, there you are.
Get that glare out of the way.
Can you see me?
I see your picture, but I don't see you yet.
Huh. Okay. Okay, here we go.
Let me.
Can you see me now?
Yeah, I can see you.
Hi. Oh,
Hi.
there you are. Awesome. Let me add Lee real quick. And first, thank you so much for doing this.
Oh, you're welcome. Deanna wants to be in it too.
Oh, I have Allie here too. Okay, so I'm just waiting on Lee. Let me give him a call. And okay, how's your day going? Happy New Year.
Happy New Year to you. I just was at acupuncture.
Oh, awesome. For yourself?
Yeah. Mm-hmm.
That's awesome.
And yeah, so I was just running back from that while I was doing it. So figured I'd.
That's awesome. Let me just give her a quick call. I don't want to take up a lot of your time.
Okay.
How much time do you have to do this?
About an hour, because I'm going to put shoes on and run out the door. So
no, that's
I'm
awesome.
not going to get cold.
And we'll try not to do the whole hour because I value your time. I don't want to take up your whole night.
No. I wanted to try to do this 2 months ago, right? So it
Sorry, Dr.
can do more of it. He can do.
Sounds good. Let me know when he's ready. I can just add him to the video. Sounds good. Thank you. Sorry about that.
Okay.
I've got Allie here. See her.
Doing?
She's doing good.
Allie.
It's hard to really tell. I mean, she seems to be doing fine.
Mm-hmm.
So, I've got some. So I was hoping we could talk about. Lee can talk about. We can make it like kind of like the epidemic or in cancer, autoimmune. I would love for you to touch on microbiome, ozone, autoimmune, Plechner too, because there's not a whole lot of stuff on Plechner out there.
Okay.
And I feel like there needs to be. I have a bottle of ozone, so I can show. I have some supplements, standard process, restore. In case you mentioned that, I can just show it quickly. Microbiome therapy. I was hoping we could talk about that and how we can treat and prevent cancer as well, and what you're doing. Maybe you could talk about your horse Champ and what you went through there, and just kind of how you got started, and then Lee can kind of touch in on cancer, on cannabis, and how inflammation is the root of this everything, and how it can help the dogs as well. And you guys can touch on both your parts, and if you have anything you guys agree on, or you want to add anything to what he says, or vice versa, I think that'd be awesome. Like, kind of like a little mind jam, like Rodney Habib and Karen Becker do. I think it'd be. Is it okay if this gets posted on Facebook?
Yeah, I think so. I mean, I'm hoping that because if I go into the cannabis parts of it, which I'm not supposed to be talking about, but I can totally support it and allude to it. I'm not prescribing it to anybody. I mean, that's the whole issue, is that you're not prescribing it. So.
You can be if it gets mentioned. I don't want to anyway.
Listen, I think it should be used all the time, and I gotta, how do we get I mean, now it's getting to be so much easier that the states are beginning to accept it, and we're able to do this. So it's a definite, push to do it.
For sure. That'd be great. I mean, like inflammation and how even like pain management. You got a dog that's getting older and has arthritis, and instead of going for Rimadyl, you could use full extract cannabis oil. You could use tinctures.
Right. There's stuff. Right. So I mean, for pain management, there was just actually in the AVMA journal, which I was trying to read today, that there's a white paper task force to try to figure out we can't use opiates anymore.
Yeah.
So if we're not able to use opiates, the ozone that's what I'd like to actually cover. I didn't get to read the whole article. I was reading it at the acupuncturist, but there's a whole white paper on how to do pain management from the AVMA. And I think it did mention acupuncture and complementary medicine. And I think that would be an important piece, is to opiates. Ask sense, like they were The opiates for old stuff. Now let's use the new stuff, you know.
Yeah,
So.
I think that's amazing. I would love to talk about that too, and that would be incredible to talk about if you could share that. So Lee just joined. Lee, can you get on video? So you can click on the video icon at the bottom. The movie, and it should. You're there. We go.
Hi, Lee.
Hey. Happy New Year, guys.
Happy New Year to you.
So, would you guys mind introducing yourself? Maybe Dr. Roman, you can start.
Okay, we'll start. Is this going to get recorded now, or are we recording now?
Yes, we're definitely on.
So, I'm Margo Roman. I've been a veterinarian for over 40 years in Hopkinton, Massachusetts, and I do integrative medicine. I have a practice called MASH in Hopkinton, where we do acupuncture, herbs, homeopathy, ozone therapy, microbiome restorative therapy, and other modalities that are on our website, which is mashvet.com. And the idea behind our practice is that we want to enable the immune system and the body to heal itself. And what can we use? Is it something that we can use from 5,000 years of acupuncture, herbal medicine, or compounds that we're really learning about that are old remedies, like cannabis, and like other ways of doing things. Even ozone's been around for over 150 years. So how can we get those things to be utilized in medicine, instead of just thinking that we have a lot of pharmaceutical and big pharma and drugs to take care of these animals? So that's my practice. And right here is one of my puppies. This is Hannah. Hannah, you want to say hello to everybody? Hannah is 11 months old, and she's my 5th generation holistically raised standard poodle for 25 years. So she's very healthy puppy, and we're raising her both in a holistic way, but also trying to raise her more plant-based, so we can not kill as many animals to feed our animals. So she's about a 92% plant-based puppy, and she's thriving and doing very well, and her blood tests are all nice and normal, and her teeth came in perfect. And so we're just trying to figure out a way that we can be sustainable and help prevent global warming, because animal agriculture contributes to more of global warming by using meat and animal products to in our food chain. Anyway, but we can stay in the medicine part, and I appreciate all the things that you guys are doing and bringing cannabis to the pet owners and to their pet caretakers. It's an herbal product that has been part of human history forever, and sadly became sort of tainted with bad PR. And it's great to have an ancient plant like that back in the circulation to help heal. And if we're managing pain, the AVMA just today came out with an article about how veterinarians need to stop overdosing and overusing opiates, because so many of the animals are bringing home the opiates, and then the owners are actually using the opiates that the animals get. So how veterinarians are getting a lot of restriction on the use of antibiotics and the use of opiates, and it's very important that these topics get discussed, because the more antibiotics we use, the more dysbiosis we get in our gut. And that's an area of medicine that I'm very, very passionate about, is the microbiome. And then with pain management, the more opiates that are out there, every day 46 people in the United States die in hospitals from opiates, and 176 die from overdoses of opiates with that not being in the hospital. So we have a serious, serious epidemic that's affecting the life expectancy of Americans right now. And if we can, move that whole consciousness to doing alternative with controlling pain and inflammation, why not? Okay, there I am.
That's amazing. Lee, would you mind introducing yourself?
Hi, my name is Lee Simpson, and I am the founder of an organization called King Harvest Wellness. We are a cannabis oil, specifically a marijuana oil critical illness specialty company where we focus on plant-based essential oil extraction to stimulate different areas of the body, and more specifically, a lot of our excitement comes into play where we're talking specifically about the endocannabinoid system, where we see specific types of essential oils from different heirloom varieties of cannabis plants will stimulate and create therapies in different areas of the body that applies to cancer, neurology, autoimmune, age-related wellness, all that kind of stuff. But our goal primarily is to focus on system-wide inflammation and dealing with underlying mechanisms that cause inflammation to get out of control and put them back into appropriate levels so patients don't further get sick. Many people come to us with a lot of different symptoms without a bottom line diagnosis, and they're in the trough of the wave before they are about to be diagnosed with something pretty significant. What we do is we work with anti-inflammatory organic cannabis oils, and our specific type of extraction process is hoping to deal with the underlying causes of disease and to reverse the disease process itself.
Very good.
So, and I'm an organization called kingharvest.org. That's King Harvest Wellness or kingharvest.org, and we've been around for about 9 years. It's been north of 15,000 patients overall, and if you go to kingharvest.org and give us a call, we really focus on educating people about cannabis, nutrition-based education, and all non-Western medical therapies that can be tied together to work with a patient's overall wellness protocol.
Awesome.
So that's what we do.
Great, thank you, Lee. I'd like to talk about, we're here because of the dogs today, but I'd like to talk about specifically, this cancer epidemic we're in, and inflammation, is the root of it, as you both know, and how we can prevent as well as treat. And Dr. Roman, maybe you can touch upon some of the therapies that you're doing. Ozone therapy, I administer this. You give me this to give Allie at home. We can talk about autoimmune issues, Plechner syndrome, microbiome restorative therapy, which is amazing, and gut health. 85% of the immune system is in the gut, and talk about that. And Lee, you can touch upon inflammation as well, and how certain strains and strain-specific cannabis oil, properly made, lab-tested, organic, and so on, can help target inflammation. And we can talk about lymphoma in dogs and the success you're seeing, and how a lot of times you can just put a stop to it because you're going after the underlying mechanism. We can just touch upon it all, and that would be really awesome. So.
Talking about cancer could take us like 6 hours. To summarize it, over 50% of dogs are getting cancer, which is really horrific. And as someone who's practiced for 40 years plus, I never, ever, ever, ever saw those numbers. Ever saw those numbers.
That's over 50%.
64% of golden retrievers are getting cancer. Wow. So you've got this is like craziness. Around Boston, we have like 4 oncology practices. That's ridiculous. And they're booked.
Yeah. So
we're doing something wrong. Instead of thinking we have a solution, we are really doing a lot of things wrong. And how can we change that? There's been, in exploring integrative medicine, and I'm always trying to find some other way to do it, because we're not 100% successful in anything. And if any physician thinks that chemo and radiation and the practices in oncology are really saving huge numbers of lives, they need to look again at the numbers that they're doing. And, in veterinary medicine, we get better time than they do. And when you talk about alternative and conventional chemotherapy, sometimes that we're pretty similar, but the amount of negativity that they go through and cost for the chemo, radiation, and surgical intervention is quite involved. And if you can,
was really well said. The quality of the time is better.
Exactly, the quality of that animal's life and the the amount that they feel in that quality. I mean, that is really important for a pet caretaker. And the other part, which is not addressed, which is really should be an important part, is when these dogs get chemo, where are they peeing and pooping? In your yard, peeing in your house. What is being dispersed into our biosphere of all this chemo that people and animals are urinating into our water table? And touching the animals and their saliva and what's coming out. And when that chemo's in there, what is it doing to the microbiome of that animal's body, changing it in a way that they are no longer something biotic to live with?
20 rounds of antibiotics they did as a last-ditch effort before the dog was diagnosed, right?
Yes. And so one round of antibiotics can disrupt the microbiome for over a year, and it may never, ever come back. And so it is very important that veterinarians and physicians don't throw an antibiotic at something when they don't have another tool. Look for other tools before you throw a grenade into this symbiotic thing that's trying to protect the animal, and then they throw antibiotics into it. So that's where we've been doing a lot of what we call microbiome restorative therapy. And again, you can read a lot more at my website, which is mashvet.com. And we are doing lots of fecal transplants. So we're taking the microbiome from dogs from 5 generations for 25 years that have never had antibiotics. Oh. So if they've never had antibiotics, never had pesticides, never had herbicides, and live in an organic house, is their microbiome more diverse than a dog that's been on antibiotics multiple times in their life, has been on pesticides and spot-ons and frontline and Advantix and all those things? What is that doing? If it kills fleas and ticks, what is it doing to the 100 trillion microbes in a normal human being? So I've got the cat on one side. So yeah, I think she wants to eat dinner. But anyway, but that's the part, is that we throw all this stuff at these animals, and we don't think about what the long-term or short-term effect it's going to be. How can we enhance the immune system instead of trying to shut it down and push it into a hole, and then hope that you can get the body to crawl out of it after you've suppressed it so bad that it can crawl out and survive. And instead of doing that, we try to just increase it, which, when I think about cannabis, one of the pieces that I think is really interesting is, it's such an ancient plant. I mean, it's such an old plant. And it lived in our, during the dinosaur, eras where, all the microbiome, which is 4,000 million years ago, and it all lived in that environment, and so is there a communication between the microbes that this plant lives in, that it can somehow enhance the microbes of the gut? And that's where I think, many herbs don't work as well, because they can't work with a normal microbiome. If you're missing 2/3 or 3/4 of your microbiome because you've been on antibiotics, will the cannabis or any herb work as well as it would if you had all the species?
So that's where you get into different types of extraction methods and different types of delivery methods, if you will. And what we see on our end is that if you can extract essential oils, like, all medicines seem to be created from the Western medical platform, which is sort of woefully inadequate. And what we see is that we see cannabis oils that are made the way Western medicines are made, those are also woefully inadequate. Mm-hmm. And what we see is if you include all of the chlorophylls and the salts and the plant-based compounds in addition to the cannabinoids, those are increasing success rates by an additional 50%, just as much as the cannabinoids themselves are doing. And so what we see is that what we call whole molecule medicine, mm-hmm. that contains everything that was in the original or ancient molecule, mm-hmm. right? So this speaks to this, that not only is powerful in the cellular reproduction process, but also in the unexplained parts of the processes, which seem to be tipping their hat to gut health, right? Mm-hmm. So like if you have all those chlorophylls and plant-based oils and lipids in the gut, they probably are counteracting mm-hmm. we'd call leaky gut or all those maladies in it.
Right. So, I mean, I think that when I'm thinking about any kind of herbal, methods that I've been using, Western herbs and everything, I just don't think many of them work as well as they used to work because they are not being utilized because one microbe that's in there may react to one component of that, where another 3 microbes down the line work with the second component, and it's those two, when they come together, that actually are the curative or the supportive part. And that's all will hopefully come around in the next few years, because the microbiome, in 2000, there was one research article on microbiome. In 2016, there were 7,123 peer-reviewed research articles on microbiome. So it is the booming science, the cutting-edge medicine. And I would love to see some studies done with the cannabis, with all the diverse, looking at all the diverse microbiome. Now that they can look at the DNA, or at least make judgment, so.
Yeah, no, I think that would be great. I'm actually doing a microbiome test on Ellie from Animal Biome, so I'll be having that come in the mail soon, and I'm really looking forward to sharing that with you and with everybody on the Facebook.
I would think that there would be some crossover, and that the microbiome and the cannabis oil might actually be accomplishing some of the same things.
Yeah.
Yeah. And so, like medicines, our medicine, if you look at it, is brown and green and like a dark honey color, or it's dirty compared to centrifuged medicines that you get in dispensaries. But yeah, so that dark brown color makes it more therapeutically relevant, I would argue. It's dirty.
You need whole plant, to isolate one component of a plant, because big pharma wants to, make money on that, just, extraction of the plant that they can do. That's just one portion.
And
whole idea is blending of it,
The whole plant is a misnomer also, because that is a term that was created by the people that they just run the trim off the cannabis plant. So we call it whole molecule, which so whole plant means, like, it sounds great, but it's like I ran the whole plant and I can get twice as much yield out of my batch. So it's a money thing. For what we do is flower only, or buds only, that retain a higher concentration of what is called the terpene profile. And the terpene profile is the complexity of not just the THC and the CBD, but all of the compounds. And like a terpene is something like limonene, limonene, pinene. It's the complexity of the actual flavor, or the flavonoids. So what's interesting is that when you're talking about microbiome, probably the smellier the biome, the more curative it is.
Right.
So the biome has terpenes also, is what I'm saying. Yeah, or fartenes.
Right. No, it's true. I mean, it's just that when you have all these guys working together, there's so many of them, that if you have no numbers, and there was, that the gas that animals produce, and some of the flatulence, very well could be, and we don't know. I mean, now they're measuring the microbiome through mouth gases, and seeing, if they can judge where the microbes are. That's another study I was reading today, and that's been going on for a while, that you can just test the breath versus the the actual biome itself. So all this stuff is coming around, and we'll learn more. But the important part of this is that we need to be doing a lot of other things to help people and animals with cancer, with autoimmune disease, with chronic GI problems. And the idea of doing alternative medicine, like ozone therapy, which you mentioned, is the ozone therapy, which is amazing stuff. And it's that's just the glass bottle that we ozonated saline. But looking at ozone medicine as a form of oxidative stress that happens to the body, that allows the body to go into a healing mode. And I've been doing it now for over 15 years, and started because of my horse, who was told by Tufts University that he would be dead in 2 days, and he lived with cancer, and he was 28. He was 26 at the time, and he lived to 2.5 years jumping in horse shows, getting ozone, and surviving after they said he was going to be gone in 2 days. And we've seen animals do the same thing, live for years other vets have said there's nothing else you can do. And that when somebody says that to me, it's like, have you tried any of this stuff? Why are you giving up so quickly? Have you tried cannabis? Have you tried, herbs? Have you tried, ozone? Have you tried so many alternative things? So just going with the traditional stuff is short-sighted on your part, on a part of anyone.
Shouldn't we be ozonating our cannabis oil product?
I don't know. Whether it would oxidize it and it can't. I don't know that. That's something. I did try ozonating lavender oil, and it didn't do anything to it. It just didn't change it. When you ozonate oils, it forms ozonides from the oils. So the ozone, whether ozone comes from lightning in our real world. When lightning hits the oxygen in the air, it becomes a transient form of O3, which ozone is heavier than air, and as it's produced by the lightning, falls to the earth and cleans the earth. So when you go outside and you smell that fresh air that you smell after a thunderstorm, that's ozone cleaning the air. When people think of pollution and they think of ozone, it's going to be toxic. There could be so many chemicals that are in the atmosphere, like nitrogen and sulfur and petroleum and base stuff and all these compounds that are toxic. And it's the ozone that is trying to clean the environment and clean it out and detoxify it. And the way that the meteorologists look at it, and they look at the ozone level, that's the only compound that they can find. If they know the ozone is really high in the smog, then they know that there's a lot of smog because the earth is trying to clean itself. So
it's not the problem, it's the tell.
It's right, exactly. So people have this misconception about ozone as being something bad, and in the truth, it's really what's trying to save our earth and make it so it's not so toxic. So that's what I'm trying to explain to my colleagues, and even who I consider very smart doctors. You say it to them and they look up into the sky and go, ozone, it's like they don't understand what it's trying to accomplish within the tissue of the body.
That makes sense. And if you think about a hole in the ozone layer being bad, that sentence alone would make ozone good.
Right.
Yeah.
So it's like, how do we utilize the properties of oxygen, the extra electron that sets up this oxidative stress that activates the mitochondria, that gets the cells working so that they start protecting themselves versus just giving up and dying, And
I also noticed that, now that we're all speaking to each other by virtue of the internet and different things like that, we're starting to discover that scientific testing itself seems to be limited and needs to be improved. Like, we see that, even the idea that there's an endocannabinoid system in the body that was missed up until the last 20 years, speaking to the idea that we already have all the tools to find everything, like i.e. measuring ozone levels or, the different ways of talking about medicine or different systems in the body, like cannabis oil and essential oils and what you're talking about, microbiome, seems to be under the umbrella of endogenics, where we're gently manipulating or stimulating an existing system already, rather than introducing a false compound or outside stimulus to create a result.
Mm-hmm.
Right?
That makes sense to me, because if you can take what's already there, the immune system wants to heal itself. The body doesn't want to die, right? And the microbiome doesn't want the body to die because it's gone, right? It gets it gets damaged. So if the microbiome has been around for 4,000 million years, it started before all the species of animals and plants where the microbiome was there, because it's the precursor of all this stuff. And it's been around and it wants to survive. Why are we trying to kill it every day with antibiotics and pesticides and herbicides and chlorine and fluoride, and we're trying to kill it instead of utilizing it? And when you talked about how, all the studies that we've done on medicine, they're not accurate because you don't understand what the microbiome is. So you could have 16 people that are being utilized and 4 of them have good microbiomes, And those are your 4 successes because of the microbiome, not because of the drug. And you get 4% success or whatever you're going to do. You didn't study that person's immune system. So you can just keep talking about these drugs and saying we had X percentage of people. Well, X percentage of people could have had very good GI tracts and would have healed themselves without anything that you would have given them. So it's really, there's so much of the big science that we've looked at that when you start to really pull it apart and saying, you know, we have to honor this gut microbiome to the highest level because it needs to be leading our interest in the body because it has been running our bodies. So I love talking about food.
I would even
It's so valuable. It really is.
I would even go so far as to say that bacterial or viral load is a component of your personality, is even a component of your free will. And so, like, if you like we think that which makes us people is our autonomic sense of self and our consciousness and all that. But I noticed that when I unfortunately had MRSA in my shoulder in an injury site a few years ago, and I was given like 5 or 6, I was given all the antibiotics, right? It's terrible. And my personality changed.
Absolutely.
Yeah.
So back to that, with the microbiome, we have seen amazing behavior changes in animals.
My personality became flat, like not as inspired, less fun, more just flat, synthetic even.
No, we give my dog's biome to dogs that are aggressive or insecure, and they become happy and playful. I've given my cat's microbiome to a cat that was, you know, unhappy and difficult, and then that she calls me the next night and says, "I didn't sleep all night. All he's done is purr on my neck. I can't sleep. He's just purring and purring and purring." So it's like there's the changes, and I'll tell you, this has nothing to do with cannabis, but it'll just put it into perspective about, you know, personality changes. I have a client who had been C-section, so she never got her microbiome from her mother as she came through the birth canal, because that's your first introduction to the microbiome. She was bottle fed, so she never got breast milk, and she was on antibiotics all her life. And she came to me because she wanted ozone and alternative medicine for her dog for cancer, and a fecal transplant. So when she hit 30, she got a yellow fever vaccine and just about lost her life. It shut her immune system down. She was in and out of hospitals and barely survived it, and decided on her own to get a fecal transplant because she felt like she had been on so many antibiotics. So she had a fecal transplant from a doctor who can do it with I guess, you know, without having C. diff. You have to have C. diff in the United States before you can get the fecal transplant.
I was going to say, how do I sign up?
Right. Well, I can tell you offline how to do it or whatever. But, whoops, my cat just knocked everything off the counter here. One second. So what she did, this is just such a fascinating story. So she went to have this fecal transplant done, okay? And the doctor gave her 3 different donors, okay? The first one was an 11-year-old gymnast that was in perfect health, that was totally just a straight A student, no question, excellent body health, athletic, great kid. The second was a 25-year-old woman who was in good health. The third was a guy, and she got capsules to take orally. She took the first capsules, and she said never in her life had she felt so good. For 2 weeks, she said mentally and physically, she had never, ever, ever felt so good. She walked around and she said, this must be what bliss feels like, because I have never felt like that. And so many weeks later, she took the second one of the 25-year-old woman, and she said she felt better, but she did not feel any of the same mental pieces that she felt with the first one. The third one was the guy, right? So she had taken this guy's biome, the doctor had gone away for the weekend that weekend, and for 3 nights she didn't sleep. She was agitated all night long. She got up in the middle of the night and she said she was sweating, and her sweat smelled like a man sweating in her bed. Okay, and so traumatized the whole thing that happened. She called him and she said, you know, what is going on here? You know, and he said, you know, I've been using this guy for many years. This is the first time I have seen this happen. And he said, but he said he's been a great donor, but he just broke up with his girlfriend and he is so devastated. So to think that the mind component of the microbiome can affect somebody at that level is truly, truly amazing.
Yeah, that's incredible. That's incredible. Lee's, just so you know, Lee's computer died. He'll be back in like 30 seconds.
Okay, no worries. We'll get the...
the microbiome therapy has just been
So,
incredible for Allie. You know, I mean, I was just in your clinic last weekend getting the rectal ozone and, you know, rectal MBRT, and I do see a crazy difference in her. And I even feel, would you say that's more effective than doing the oral, you know, giving her a little bit of a walnut-sized piece of the...
we started the first fecal bank in the United States for dogs and cats. So we have biome at our, so we're shipping it all over the country to veterinarians, so they can microbiome. My dogs are raised organically on organic food and fresh food. Everything's made fresh for them. So I'm hoping that I can keep the microbiome as viable and live as I can, so that, and then we ship it in capsules and in slurries, and then we can also ship the fresh biome. So, but it's that component of it. And the reason we mix the ozone with it is ozone reduces biofilm. So when you have dysbiosis in your gut, you have a biofilm that is it's like the slime in your mouth, but it prevents new bacteria from coming in. It's like a wall. It's like building the wall, you know, to let anybody through, right? You got to break that wall down so that the new microbes can come in and find a place to live on the intestinal wall. So we use ozone gas. The ozone gas does 3 things. One, it kills all the bacteria on contact. So it kills all that bacteria, the good stuff and the bad stuff. Clears you a space. You put the new stuff in to populate that area, and the good stuff, you know, you feed it the right things so the good stuff likes being there. So we try to develop the terrain of the gut so that the terrain is something that when it gets in there, my dog's biome says, oh, this is a great place to be. It feels like home. Or it gets in there and the dog's been eating Purina dog chow and eating, you know, kibbles and bits and crappy food. My dog's biome is probably going to say, forget it. I'm not hanging out here. I'm out the door. So we prep the gut with nutrition. We prep the gut with other, you know, colostrum and a bunch of other things to try to, like, you know, give a lot of stuff to the animals to really take care of it.
Do you like colostrum?
Pardon?
Do you like colostrum?
Yeah, you know, I have been using colostrum for 25 years. And I've always thought it's because of the immune globulins that are present in it. But have you seen the series Interconnected? Did you watch that documentary series? Oh, did you watch it? Oh, you've got to watch it. They have the first one is on, it's called Interconnected series. And it's all the newest stuff on microbiome. And it was released in December. And it's wonderful. And in that first series, there was one of the doctors that made a statement. It's like, oh my God, that's why. So he said they've been studying mother's milk in infants. This is in children. And there's a sugar that's present in the milk that doesn't seem to give any nutrient to the child. And they just realized that it's secreted by the mother's milk, that it feeds the microbiome so the microbiome can get started. So that may be why the colostrum is, well, I've been using it for 25 years and I always thought it was just the immune globulins. But now it may very well be the initial sugar that feeds the microbiome.
Baby formula for gut health.
Yeah. So they know that babies that are born by C-section do not get their mother's biome, and they have a lot more colic and a lot more issues. So now what they're doing is literally harvesting the vaginal excretions and putting it into the baby's mouth if the mother has a C-section, so that they can actually inoculate the baby with the mother's bacteria. We used to think all of our organs were sterile, but our heart has bacteria, our lungs have bacteria that are normally in there, our eyes. So when you go on antibiotics, you may be destroying bacteria that your heart needed to take care of itself. And so the paper that I've been trying to write, I was putting the correlation, when people get a heart transplant, a lot of people have behavior changes and have mental, have different thoughts and have different personality changes when they get organ transplants. And I had a friend who had a transplant, and she totally agreed with that. And another person who also had one and agreed with that. But I started thinking maybe it's not that, it's the microbiome that's in there. Because that is actually more, there's more of that than just the tissue. There's thousands and thousands and thousands of, hundreds of thousands of them. So it very well could be because I see the personality change by getting my dog's poop into these dogs. And so we call it microbiome restorative therapy. So that's what we're because it's the restoration of that microbiome.
That's amazing. Thank you, Dr. Roman. So I love everything you're doing: microbiome restorative therapy, ozone therapy, glandular supplements, colostrum. I mean, everything. We're doing it all for Allie. I've seen a huge, tremendous difference. I've also seen a tremendous difference in Allie with cannabis oil. Lee, can you talk a little bit about the difference between, which seems to be a common topic in confusion, hemp versus cannabis, and talk about maybe CBD and why also THC is important for cancer?
Well, okay. What were you going to say?
No, you could talk about that, Lee, because that's your...
Yeah. So, okay, now, again, similarly to talking about the microbiome and talking about different ways of making medicine and extraction processes, we believe in whole molecule medicine that is strain specific, as opposed to CO2 extracted medicine, which is isolated chemical medicine, like as though THC or CBD would be an individuated chemical that should be separated and used, outside of its the components that it always comes with. But so what we see is that out there in the world, online, and in similar avenues as this, people are talking about cannabis oil as though it's just about THC or CBD, and then that gave rise to hemp-based CBD or isolate CBD companies that are mass marketing these things to the American public, and it's really it's doing a lot of damage because it's giving people a false impression of what cannabis oil cannot do, because hemp isn't going to really save anybody's life, like from a oncology standpoint or autoimmune. And basically what it's doing is it's tricking the public into thinking that this is what cannabis oil can do, but in the end it's really just one of the individual compounds, and that whole market or that whole group of people, all those companies are trying to pop it up as though it's the same or just as good. Like Sunny Delight is just as good as a fresh squeezed glass of orange juice, right? That kind of thing. And so CBD only medicines don't really work, and people get discouraged and they get sad. THC only medicines don't necessarily work because patients get high and then they quit and they get scared, and there's no reason to get high for the process of doing cannabis therapeutically. So it's not about THC or CBD, it's about both of those chemicals. And similarly to talking about vitamin C, it's about the heirloom variety of plant, where it comes from. And our focus in King Harvest is we focus on a plant source for the CBD called ACDC, like the alternating current, speaking of ozone. So ACDC is one of the specific heirloom varieties. There's another one called Harlequin that have a specific type of function and chemical profile. There's another one called Harlessu. There's also Canatonic and Charlotte's Web. We've heard that too, but Charlotte's Web has now had all of the THC bred out of it this is a perfect example. They've bred all the THC out of it, and it's not saving anybody from seizures anymore. But it is available nationwide, right?
Oh, wow.
Yeah, so that's what's happening in a very large way. And so the Fed or the FDA is coming in, and they're now researching hemp or CBD as its own isolated chemical. And what we see in the state of California here is that the Attorney General has outlawed hemp-based CBD for internal use altogether across the board. So it's, yeah. So basically you're looking at hemp without THC or CBD without THC in the state of California very shortly will not be for internal use anymore. And we do tend to agree with that because hemp is basically an industrial product, you know, kind of like glycerin. In large amounts, you know, glycerin is not actually a food product and shouldn't be used for these kinds of things. So, medicines that have THCs and CBD in them naturally occurring in the same molecule tend to be, well, they're inarguably much more powerful. And they tend to stimulate the endocannabinoid system. The AC/DC plant source for stimulating the endocannabinoid system is super important. And then different types of THC will accomplish different things in the body, like killing cancer cells, reversing MS lesions, knocking down inflammation. You know, there's all the behavioral therapeutical benefits, and so on and so on and so on. You see, so hemp-based CBD, that CBD is isolated, is usually some kind of a snake oil. THC isolated medicines are really just for recreation and don't really have a medical application. What you see is plants with a robust chemical profile, including all of those 63 components, is where the curative stuff comes in, and that gets really complicated to talk about with people and make any sense to them at all.
No, I mean, it is. And thank goodness there are people that are really looking at it and trying it out on you know, with different strains and understanding that, because each plant has a different you know, DNA, and so you utilizing it, you know.
That's you know, either something not yet detected or some of the same chemicals exist in the biome as in the cannabis soils, because they all come from that murky ancient swamp.
Right, exactly. So what, you know, and that's what I think about why I think cannabis works, is to finally some of these microbes that protect the immune system say, oh my God, I can eat something that I know you guys, you know, this, you were helping me way back when, you know. So feeding some of these very ancient plants with all of their components may be part of the support that the gut needs to make it shift.
And accidentally, it might be what we have allowed to continue to live in our medicines, and you know, not even knowingly, which has made them so more successful than other people's medicines.
Right.
Because we're frankly like, sure, it's bud-only medicine, like heirloom specific, like I don't know.
Right.
You know, what we know is we make the finest cannabis oil in North America, and can't say cure, that's illegal, but the solution rates are off the charts compared to, you know, anything you can get down the street.
Yeah.
So
I think that all of this stuff is, you know, the more we can understand how our immune system works with relying on our gut, relying on the nutrition that we get, the food that we get, and the quality of the air that we breathe, and the water that we drink, it's all can really damage, you know, how delicate, but the ability for it to survive. But we need to be taking care of it much better in a way that's, you know, not going to kill our earth. So
I feel like I've noticed a big difference with Allie, you know, with her adrenal fatigue due to Plechner syndrome, that estrogen cortisol imbalance, you know, not being able to fire up her immune system. I feel like I've noticed a big difference using the FICO, you know, a sativa THC and CBD strain specific rectally, because you know, half of our cannabinoid receptors are in our colon, and you can literally give a large dose of potent medicine up the bum, and it just gets spread throughout their system, and is fast acting. And the beautiful part is there's no head
maybe
it's amazing.
that's part of the success of it is, and I don't know because Peter, you're the only one that I have that is doing this, but we all want to learn from each other. But maybe putting it in there where the microbes are at their most high numbers, and it's like you're putting fish food into a fish tank, and they're yay! Finally somebody's giving me something I can talk to the other ones about, right?
Exactly.
So maybe there is that component that we haven't really started to explore because most things are done by ingesting or by smoking, and it has to go through the lung microbiome and the lung. Maybe it's the gut because we know the gut is the immune system, so maybe it really needs to be put in directly and not or maybe another thought, I'm just thinking another thing, is somehow encapsulating it so it can go quite extensive down into the lower colon. So you're not doing it by enema, but you're getting a 3 or 4 capsulated levels. So it goes through the stomach, goes through into the small intestine, then gets into the, into the jejunum down a little bit further, then breaks open and then says, here guys, here's your food, come eat it all,
Yeah.
Maybe that's
true. They have time release gel caps now, gelatin capsules.
Are you making those now?
No. We've a patient turned us on to them, and so we're now making, FECO capsules in different time release.
Wow, very cool.
Things.
Because that might be something that to look at to see whether that's that's something that maybe it is just feeding the microbes that's doing it, nothing else but that.
Totally. This is all fascinating.
FECO is FECO, full extract cannabis oil. The potent marijuana oil, as opposed to tinctures, which are pretty gentle and introduced to the system, and who's never had it before and develop tolerance and microdose. And the FECO is prepare the body for a more potent medicine, which is ultimately needed.
Mm-hmm.
Well, I mean, my thought with patients that have cancer, again, I'm not telling anybody to do anything, but I think they need to get a good, healthy microbiome from a healthy person. And especially if they have been subjected to, diagnostics that, people didn't know what was wrong with them, and they put them on antibiotics, and they put them on NSAIDs, and they put them on opiates, and they put them on all these different suppressive medications, and they've lived a fairly conventional life, drinking diet sodas and drinking fluoride in their water. They may need to restore their gut flora before any of the stuff really enhances their ability to heal themselves. Because if you don't have those species in there, you may not be able to ever get them unless you transplanted them in there. So that's just, yeah. So
myself personally, I started on the cannabis oil journey because of my seizure disorder, and that's also has inflammatory components to it. And so I'm excited about looking into biome for restoring my own gut health because.
Well, when you had MRSA, for MRSA, not that I want cases of MRSA coming into my practice, but Ozone gets it immediately. I mean, I've had 4 or 5 animals that had MRSA that they were going to amputate the legs, and they couldn't amputate the legs because, the dog had MRSA. They were afraid if they did it, they wouldn't be able to cure the incision. And we injected Ozone into them, and they killed it. Just kills it right away. So why Ozone is not used in any surgical procedure anywhere, regular surgical procedures, should inject Ozone after they exit that body to kill off the microbiome that's there, that they don't want in there, that they could have brought it in there from outside. Why not?
As a infection. Yeah.
I mean, and I think any colonoscopy should have Ozone. So when they, the instruments that they use for colonoscopies, they can't disinfect those things. And the same thing with your dental. Doing in dentistry, the water, the biofilm in the water system, most people wouldn't even go to a dentist if they could culture out what's in the coliform that's in the mouth. So these are scary things when you start thinking about introducing. If you're a weak individual and you introduce biome from things that are not even as good as you are, right? It can really throw you off. But that's where Ozone survives that. Not survives it, but gets rid of that and allows the
So
clean.
if I was to tell kingharvest.org patients to go and to get an ozone machine, where would I send them?
Well, on my website, I have 3 or 4 companies that I think are very reliable. There's some very good companies out there that make ozone generators. But it's mashvet.com. But there's 3 companies that I sent to, and there's another one that someone had gotten from Australia that was a very similar machine too. But on my website, I put resources in there, and those 3 companies do a very nice job making machines. There are now, it's amazing, going to ozone conferences now. There are now, in 2011, they brought ozone to veterinary medicine in Brazil. In human medicine, it had been used since the 70s, but they brought it to Brazil. They're now, a year and a half ago, I spoke at their first conference on ozone. I was a keynote speaker. There's 600 veterinarians a year and a half ago. There's probably now 800. Everybody's using it now because it's inexpensive, it works, it's safe, it's amazing. They were presenting non-union fractures in dogs that we can't get it to heal. They amputate the leg, right? And they can't keep doing multiple surgeries over and over again. They took the plates out on the leg and put a splint on it, injected ozone several times into the fracture that wouldn't heal. 2 weeks, they all healed. 2 weeks. It's just slide after slide of dogs healing. So it's just, antibiotics are passé. Antibiotics are from the 20s. Yeah, they're back last, this new century is not for antibiotics. We've overused them and they are not working the way that we thought they were working. And so how do we control inflammation?
So what about overuse of antibiotics? And then we go look at our blood on a blood slide, and now we have bugs inside of our red blood cells, not just in our blood. What's that? And how do we get rid of that?
The microbes, the viruses, there's spirochetes. There's so many things that are getting inside our cells. When you look at live, blood smears, and you see all the stuff that's in the cytoplasm, that's not normal.
Will ozone help with this cytochetes or spirochetes?
Spirochetes, yeah, like Lyme disease, yeah. So spirochetes, ozone kills spirochetes like on contact. So like ozone for Lyme, for anaplasma, for Ehrlichia.
A lot of King Harvest Lyme disease patients ask about, how much.
Ozone is wonderful. There's Robert Rowan, who is out in San Francisco. I don't know if you know him. He does the Zossman machine, which is a high, you can do like 10 pass machine. And the ozone kills the spirochete. And what it does is, and then I use ultraviolet blood therapy, which changes, it uses ultraviolet light and it kills the spirochete, kills the bacteria, and then you inject it back into the animal, and it almost acts as like an auto vaccine for the immune system. And it's amazing stuff. I stumble across this stuff because because of my horse, I'm going to all these meetings and meeting some of these amazing, what I call Renaissance doctors who are seeking another way. They can't just give up on their human patients.
Yeah.
They get to listen to them speak and go, well, can I try that on the animals? And yeah, let's try it, and then when it works, it's like, oh my God, So, so we share a lot of information at these meetings, which is the way you're going to learn, is if everybody, contributes.
Well, I feel like I've had a lot of success. I do, Lee, you were left for dead by, pharmaceutical companies, and, you almost lost your life taking, with the opioids, and, similar to Allie, she was left for dead by Tufts University. I got sick and tired of hearing, we don't know what's wrong, bring her back if she gets worse. She, was in the ER. She almost died. I remember looking at her that day. She had lost, 15 pounds, and, literally every other week was on antibiotics, metronidazole for diarrhea, loose stools, just over and over and over. Completely shot her immune system, and then.
Well, that if you only have one tool, what do you use?
Right.
If you only have a hammer in your hand, everything's a nail, right? So when Tufts University or any university has only tools that are presented by big pharma, what do? You only get taught things. And that's the sad thing. There's so much more that students can learn. And that's where I've so hope someday that university would have their eyes open and look around and have the opportunity to help students learn more and understand more and learning. You know, that's the most important thing, because if you don't question, you're never going to learn.
Right. I agree. And you know, you both have saved. I feel like you both saved her life and have given her true quality of life back. She's going to be 10 in a couple weeks, and we climbing mountains still. You know, climbing 35, 100-foot mountains around New England, and it's just amazing. She's bouncing around like a mountain goat thanks to Lee, and she's got a microbiome back thanks to Dr. Roman. It's just incredible. You guys are amazing, and
Thank Hannah. Thank Hannah. She's at Hannah. Thank you, because you have good microbiome.
Lee, do you have anything?
Yes, you do.
Anything you want to say about cannabis for pets, or?
Cannabis. The most exciting things in veterinary medicine, I would argue, right now. And any patient or any individual that thinks that they've been given a death sentence or that there are no other options, the things that King Harvest and kingharvest.org can provide will give a whole, and just similarly to what Dr. Roman is saying, there's a lot more to health and wellness than the 1950s era scientific testing and doctors let on. And though my grandfather's generation was brilliant, they didn't know everything, and we're here continuing to discover things. And my hope is that legislation and law can eventually get in line where we're going to be able to enjoy a right for life process of healing and living in this country. Cannabis oils and things like microbiome, also illegal. Those are things that are going to produce so much helpful benefit, it's going to upend the Western medical system. And so right now we're in a crazy-making period of time with politics where, all the good things are not available to us because the government's trying to figure out how to make money off of it. And I can only hope that cowboys like me and King Harvest will eventually become outdated and
maybe the government could look at it another way. If people aren't sick, they have plenty of time to work and earn money and pay taxes. So you know what? Maybe that's, let them be healthy enough to work and feel good enough that they want to work, and versus being sick all the time. So maybe that's the way to save money, making sure everybody's healthy, that they feel like there's joy in what they do every day, instead of killing themselves because they're depressed.
And the last thing I'll say is that King Harvest is about to put out a full line of CBD pet edibles.
Oh, good.
And
Okay.
they're whole molecule, and they're going to be named after our dogs that you just heard me barking in the background.
What are they going to be called?
They're being made by a company called Solely Raw out of San Diego. It's a raw pet food company.
Okay.
And, I don't know exactly what they're going to be called so far, but I know that one is going to be named after Lefty, and one of them is going to be named after Cheetah.
Aww.
Yeah, Dr. Roman, Solely Raw is a raw food supplier out of California.
Okay.
Me and Bridget and King Harvest use for their dogs, Lefty and Cheetah. And do you have anything to add about Dr. Roman, about the therapies you're doing and how it can help cancer in dogs?
I think people can learn how to take care of their animals in a more inclusive way. The American Holistic Veterinary Medical Association, which is over like an umbrella group of holistic veterinarians, is a place to start in your location. You can go to ahvma.org and find a veterinarian in your area that understands integrative medicine. They can always find other veterinarians that can help them, whether it be with cannabis or with microbiome or with ozone or with acupuncture. So, getting a vet from there and having them be open to adding other modalities to what you're doing is really getting the best of everything. Utilizing when you need, and then using alternative when you also can use that. Okay.
Do you have a few minutes to answer some questions from our group members? I
was supposed to try to leave. I would love to. I'm happy to do that, but I was hoping to get out of here by like now. But if that's okay.
No worries. Thank you for your time. I really appreciate it.
Happy to answer questions from your group. So we can do that at some point. And I just need to go. Okay.
All right. Sounds good. Thank you, Dr. Roman. I really appreciate your time. Thank you for joining us. And,
Okay.
love you guys.
Thanks a lot. Take care. Okay. Bye.